While the country grapples with a third wave of COVID-19 infections, vulnerable groups in rural communities continue to bear the brunt of already existing challenges, including inadequate health resources that have further been exacerbated by the COVID-19 pandemic. Misinformation and vaccine hesitancy also hamper the vaccine rollout program for older persons in rural areas. To highlight the impact that COVID-19 has had on older persons, we are joined by Dr. Wagner. He is a research fellow at Wits MRC Agincourt Research Unit at the Wits School of Public Health. Great to have you on the program. Thanks very, very much for your time, Dr. Wagner.
Thank you, Leanne. Good morning to you and to all your viewers. Great to be on the program.
Let's focus very importantly this morning on rural areas. What have been some of your observations when it comes to, firstly, infections that are in COVID in rural areas at the moment?
Absolutely, and I think it's a very important area and context to highlight. So we have conducted some work at the MRC Wits Agincourt Research Unit in rural Mpumalanga, together with colleagues, Professor Cheryl Cohen and others from the National Institutes of Communicable Disease. And what we found recently, these are some preliminary findings, we've submitted this research for publication, it's currently under review, is that actually in rural areas there is less of a prevalence of infection than in urban areas, both in terms of prevalence and incidence. However, that said, there is still substantial risk in rural areas for acquiring and transmitting COVID-19 infections. And as you rightly highlighted, Leanne, a lot of these rural areas aren't as well equipped to deal with COVID infections, severe COVID infections requiring hospitalizations that some of the more urban larger centers would be more able to cope and deal with. Yeah. And this is particularly amongst older, elderly rural South Africans who are, as we know, more at risk for more severe COVID infection. So it is definitely a concern. Like I said, we are seeing slightly lower levels of COVID in rural areas, luckily, thankfully. But we are very concerned about these increasing surges that we're seeing in these larger urban areas and worrying about the spillover effect that occurs due to interprovincial travel into some of these rural areas.
Yeah, which has always been a concern, that you see a lot of people from urban areas making their way home, going home for festive seasons and visiting their place of birth and their home villages or whatever the case may be, to spend festive occasions and just visit families. And this is where the spread begins. Interestingly, we actually had a conversation in the previous hour with both the Health MEC from the Western Cape and from KwaZulu-Natal, and they both of them pointed to rural areas where they are seeing more infections taking place. And that is a great concern, purely because we know already these areas are under-resourced when it comes to healthcare. Perhaps as well, is there enough testing? I mean, do we really have adequate information as to what it looks like there?
Sure. No, that's a great question. And, research does take time. And the research that I alluded to was primarily in kind of the wave 1 and wave 2. So obviously this research is ongoing, and with wave 3, it'll be interesting to see, the incidence of transmission as well as acquisition. And it is certainly a problem in terms of testing. Just access to testing. We talk about the availability of testing, but in a lot of these rural areas, the road infrastructure isn't so great. Taxis and public personal vehicles all cost money. And so, folks aren't necessarily testing. The other important finding that is very interesting and came out of this work that I alluded to earlier is the fact that 84% of individuals who actually tested positive serologically didn't show any symptoms. And so this was a very kind of intense twice a week visit to households to ask about symptoms. And what we found was that 84% of individuals actually didn't show symptoms. And as we know, and as you and I as well, we'd be unlikely to test if we don't show any symptoms, because we wouldn't believe or kind of expect that we would have COVID. And so you're absolutely right, Leanne. I think that there are a lot of people walking around asymptomatic, not showing any signs of symptom, that are likely to be infected with COVID. and especially younger ages, as these folks kind of migrate either back, temporarily to the kind of their rural villages or rural homes to see older family members, or just, go out to the mall or go out shopping or go out to their work and come home, they are potentially asymptomatic, potentially infectious, and potentially then infecting older family members. And so this is, a significant risk, especially in rural areas where, again, the healthcare system might not be kind of set up to deal with some of these surges that we're likely to see.
So we've always heard from government that they really identified urban areas as the best areas to use the Johnson & Johnson vaccine, purely because of storage. It's also a one-shot injection vaccination, so you don't have to keep going back and doing that second shot. So it's a one-shot, that is the best. However, there have been so many delays. Where are we with regard to vaccination in the rural areas? Is it getting out there? That's a question I'm sure a lot of people are asking, because there is a big population of over 60s, and what is vaccination looking like?
Absolutely. No, absolutely. And just to put some kind of figures to what you allude to, Leanne, I mean, in terms of the South African population, the Health Systems Trust in 2019 estimated that the population of South Africans over the age of 60 was about 8.3% of the overall population. So that, is about 4.75 million South Africans being over the age of 60. And so just looking quickly at kind of the government statistics that they publish on their website about registration for vaccinations, about 2.6 million individuals over the age of 60 have registered for vaccination on the electronic vaccination data system, the EVDS system. So that's about 55% of the total South African population over the age of 60 that have registered to receive a vaccination. Now, it's a little bit more challenging to actually tease out how many individuals over the age of 60 have been vaccinated. But what they have done, and as you alluded to, Leanne, the Pfizer is being administered now, even in rural areas. And anecdotally, I've heard of individuals in rural Mpumalanga and Bushbuckridge being vaccinated with Pfizer, the first shot. And if we look at these data, from those that have been vaccinated with Pfizer, about 1.48 million individuals have been vaccinated. And so if we assume, and it's a bit of an assumption because we don't know how many of those individuals are healthcare workers, but if we assume that all of those individuals are 60 years or older, then about 56% of the 60 years or older that were registered have been vaccinated. But in total, about 31% of the 60 years or older population have been vaccinated. So there's still quite a gap in terms of those over 60 that need to be vaccinated. And obviously there's heterogeneity in the vaccination rates between rural and urban centers. But that said, as I mentioned just a moment ago, I am quite heartened and encouraged by the cooperation and collaboration that I'm hearing about from a number of different rural areas. As I alluded to, I spoke with one of my colleagues and friends over the age of 60 in rural Bushbuckridge, and she received her first Pfizer dose last week. And what's happening is that these doses are being administered in churches, in rural community centers, in schools. And so it's really encouraging to see this almost mobile vaccination type program that's emerging, building off of the successes of home-based care organizations, of community health workers, and things like that. Yeah. So I agree with you that there's a lot more that needs to be done in terms of getting the vaccinations out there. But I am encouraged by these anecdotal stories of older persons being able to access vaccinations in some very difficult contexts, some very difficult rural areas. Yeah, and under difficult circumstances, because we know, unfortunately, we saw what happened, I think it was out in the Eastern Cape with that whole scooter ambulance thing, and the money that was spent there that should have been dedicated to rural areas, and it really wasn't. And we've seen what's been happening, and the unfortunate corruption that goes with the makes the issue even bigger, where those should have reached communities
and it didn't. But what you're saying is very, very important, because when you have the involvement of the likes of your traditional leaders, your churches, your community groups in specifically the rural areas, you'll see that there's a bigger uptake. Education must be quite important there, because there's always myths and untruths that are being told and spread. And, these spread very fast in small communities. A lot of people speak to the fact, and again, I quote the MECs from both KZN and the Western Cape saying that there's a lot of misinformation in the communities out in rural areas where they say, no ways, I don't want this vaccine. I've heard terrible stories. Do you find that as well, that there's hesitancy due to a lack of information?
So I do. In talking with older individuals, and going out with home-based care organizations and community health workers, there is a level of suspicion regarding the vaccine, regarding COVID, and the whole kind of process. And perhaps it's because I am more kind of in the health sector, that they don't maybe air kind of their suspicions as openly, as they would to others. But there is suspicion, as well as just questions, general questions about the vaccine. How effective is it? If I receive the vaccine, could I still get COVID? General kind of questions that are sincere, and questions, that you or I, or some of the viewers would also have. And so, there is misinformation, absolutely, as well as just general questions. And I think, that the information, the correct information is out there. However, I think that besides just getting the information out there, it's also important. It's important to determine and understand where that information comes from and who it comes from.
Yeah.
When I went out with the healthcare workers, community healthcare workers a few weeks ago, they were providing this information, and they are a trusted source of information to these rural older folks. And so it's not only just about getting the information out there, but getting the information out to the right people so that they can then discuss this with older folks. This also, not just community healthcare workers, but also younger family members who live with older individuals, older family members. I think it's important that they understand, the value of the vaccination and the value of the vaccination program.
Yeah.
One of the things I always say is, yes, a vaccination, any drug always carries some risk with it, regardless of what we take. And a vaccination is no different. And, studies have been done that show that these vaccinations prevent severe cases of COVID. And that's really why we're advocating for this. It's not to say that if you get a vaccination, you're not going to get COVID. No, what we're saying is if you get a vaccination, you're less likely to have a serious, severe case of COVID requiring hospitalization and potentially resulting in death.
Yeah.
And that's the message I think that needs to get out there. And as you alluded to, Leanne, it's about engaging with community leaders, engaging with respected members of every aspect of civil society, and explaining this in terms and ways that are understandable. And that can also to help to overcome some of the suspicion that we are facing.
Yeah, very important point you've raised there, and I'm glad you highlighted it, because there are people saying, yeah, but and I even quote friends of mine that are in the medical field, and they are still hesitant to get it, and saying, yeah, but I'm seeing colleagues getting it, but the reality is that it is about the severity of how you get it. So that's what studies have proved and shown, and we're seeing a lot of other countries that are opening up and sort of enjoying life again due to this. But let's get those doses first, and then we can talk more about that. But that's a big thing. Before I let you go, I just want to perhaps get a little bit of your views on where we're at right now in terms of this third wave. Some are fearing that this could be bigger than the first and second wave that we saw here in the country, certainly in Gauteng. I know that's where you reside as well, but Gauteng is in uncharted territories at the moment. This third wave, when we look at that graph moving higher, it's almost overtaken the second wave already in terms of infections. What are you looking into this?
Yeah, no, you're absolutely right, Leanne, and it is concerning. And as you allude to, we are in uncharted territories. It is very, very concerning to see the rapid progression in the number of cases that we're experiencing now. And as has been alluded to. I mean, we saw the minister's report last night. 13,000 plus cases. And a lot of those are in these urban areas, Gauteng, the Western Cape as well. It is very, very concerning. And, there's obviously multiple factors that are likely to be influencing this. One is just, the infectivity of this variant strain. The other thing that I think is happening, and I mean, this happens to all of us. I mean, this has been an ongoing 15-month plus, pandemic that we've been dealing with. And I think people do, and myself included, do kind of grow tired or weary of these very, very important guidelines. And I think, if we take anything from these kind of dire signals of this third wave, we just need to kind of re-energize ourselves collectively, wear masks, social distance, avoid going out if we need to, because we are in uncharted territories. And, as we see right now, the projections are suggesting that this wave may very well overtake the first two. And this is scary, this is concerning, and all of us should do our part, regardless of our age, regardless of, what we perceive our risk to be, because this is a public health crisis and we need to view it as such. It may not be that I'm necessarily worried about my risk, but, I do have older family members, I do, interact with people, and I need to consider their vulnerability as well. In approaching my life related to COVID.
Indeed. Yeah, well, Dr. Ryan Wagner, thank you very, very much for talking to us. I think important information put out there to our viewer. Research fellow at Wits MRC Agincourt, who this is a research unit at the Wits School of Public Health, focusing a lot on rural areas and trying to get the rural areas vaccinated, and also getting any falsehoods out there and trying to, I suppose, convince the communities that this is perhaps a life-saving thing you need to be taking. All right, that pretty much so wraps up the program on SABC 2.